Halo, Assalamualaikum. So, boleh dengar ke? Okay, thank you. Okay, thank you. Okay, Assalamualaikum and very good evening. So, welcome everyone. So, thank you for joining us for today. So, my name is Staff Nurse Fikridini, staff nurse from SASMED Team Department. So, today we are presenting pressure injury versus AIDS, presented by Miss Yvonne Low. Just a little housekeeping before we get started. If you have any questions during the presentation, please type them into the question box section in your Zoom. Please do not write your question on chat box, takut nanti tak perasan, terlepas pandang. Okay, so I'll bring them up during the presentation, and we will also have time to question at the end. Now, without further ado, we will turn the time over to Miss Yvonne Low, our presenter today. So she is Bachelor of Science with Honour from University Malaysia Sabah. Currently, Miss Yvonne is a product specialist at B. Brown Medical Supplies. So without further ado, now I would like to invite Miss Yvonne to deliver her topic on pressure injury versus AIDS. Please mute your mic and join the webinar. Thank you.
Okay. Hi. Thank you, Staff Nurse, for your introduction. Nice meeting you. Nice meeting everybody. Selamat tengah hari semua. Nama saya Yvonne Lau dari Bibra. I'm today speaker. Izinkan I present in both bahasa Melayu and English rojak sikit. Okay. Without wasting time, we should go on. Okay. So today's topic is pressure injury versus IAD. IAD stands for apa? Anybody knows? You just type in the Q&A box. Later I'll go through. I will tell you later on apa itu IAD. So okay. National Pressure Ulcer Advisory Panel NPUAP 2016 mereka dah tukar terminologi pressure ulcer. From pressure ulcer to pressure injury PI is no longer called as pressure ulcer lepas 2016. But then later in my slide nanti you akan nampak pressure ulcer, but some paper we quoted before 2016 because you might be wondering, they really changed the term pressure injury, why they still call it pressure ulcer? But the paper they wrote before 2016, they used the pressure ulcer term. So globally memang NPUAP, National Pressure Ulcer Advisory Panel, kata clinician often confused and uncertainty to diagnose between these two, pressure injury and IAD, or it can be combination of both. So, tapi patient ada risk of getting pressure injury will also develop IAD, and it's always difficult to differentiate between these two. So this has led of development of program, pada hospital keluar program, protocol untuk prevent pressure injury. And because sometimes if your staff they wrongly classify IAD as pressure injury, this will make your pressure injury punya percentage higher. Eventually, actually is IAD. Kalau it's wrongly classified, this will make your KPI punya pressure injury tinggi. So you have to know how to distinguish between these two. So in addition, some national organization has created major campaign untuk reduce number of pressure injury. For example, macam I pernah join a few government hospital, bulan 11 biasanya they will do the stop pressure injury punya month. It's the world punya campaign untuk stop pressure injury. They will usually do campaign for a month to create awareness to the patient punya family, how to do when patient bedridden, macam mana nak jaga patient and also for the staff. Okay, So the global initiative, the European Pressure Ulcer Advisory Panel and other national, they came up with this guideline and it was published. And they actually calculated, mereka calculate cost untuk healing 10 pressure injury is equivalent untuk 5 knee replacement, 6 hip replacement, 9 pacemaker, and 5 bypass. So we take example, knee replacement. You see knee replacement punya cost. Okay, untuk government hospital, knee replacement adalah free lah, but then in private hospital patient bila nak buat treatment is mahal lah. Okay, so this is one of the data we got from one of the hospital 2015. The ICU punya admission per year is 205,000 cases per year. So number of new pressure injury and develop is 12,000 cases, which is 5.8 is high. Actually, KPI is have to be at 3 or lesser than 3. Correct me if I'm wrong. Yeah. Number of patients with pressure injury and that develop from rumah is 35,000 cases per year. So, okay, one knee replacement. This is one of the costs we get from the private hospital at this average punya cost untuk satu knee replacement is 30k 30,000 ringgit. So 5 knee replacement 150. Because just now we say 5 knee replacement what? So 5 knee replacement 150k untuk treat 10 pressure injury. I'm not sure about MOE punya knee replacement punya cost. Maybe it will be cheaper than this So let's say 35,000 cases per year. So berapa? 525,000. You can buy one houses. Maybe in KL you can just get a condo. I'm not sure. Maybe you can get a landed in Kuantan. So expensive. Provided sekarang punya advanced wound dressing memang dah mahal lah. Gold dust pun 100 lebih lah. So yes, here. But then moisture lesion yang caused by incontinence often tadi I mentioned often classified as pressure injury or pressure ulcer. So this will make your pressure ulcer punya percentage is higher. So IAD stands for Incontinence-Associated Dermatitis. I'm not sure about MOE because I learned that a few hospital mereka sudah pakai this term IAD. Some hospital they still use this term nappy rash. It's the common term lah. Or you can some people they use moisture associated skin damage. But I know in government hospital, they use this term nappy rash. Quite it's been some time already that they use this or diaper rash. But yeah, maybe you can try to change the term to IAD. Yeah, IAD is bila you punya skin or patient punya skin exposed too long to urine and feces, so it will cause inflammation or excoriation. So ada 3 jenis incontinence. 1 feces, kedua urine, ketiga double. So you can see the patient punya. This is example IAD. It's not pressure injury. Patient punya IAD is when they have rashes all over the buttock. Okay, you can see patient. This is double sebab patient tak pakai catheter. So patient on diaper, you can see kulit dia dah melecet, sakit kan? So mechanism of untuk IAD dengan pressure injury, okay, is different. Sebab IAD, tadi I kata dia punya skin exposed. So, ialah luar. Dari luar, your feces kena the kulit. So, dari luar ke dalam. But whereas pressure injury ialah dalam ke luar. Meaning you apply pressure. So, I suruh you duduk 20 jam. Bila you bangun, satu tempat yang merah tu kat punggung saja. It's not all over the place, whereas IAD, yes. So, satu ialah luar ke dalam ialah IAD. Pressure injury ialah dalam ke luar. Dalam you apply pressure, then the luka happen on luar, okay? So the differentiation between these two, IAD tadi I mentioned IAD is caused by urine or feces incontinence. It could be pain, burning, pressure ulcer exposure to pressure or shear. Pressure is apa BM? No, I forgot already. Pressure tekanan, yes. Shear is geseran. It's you can see tadi I mentioned the location untuk IAD is it can be bony prominence juga, but usually dia kat perineum punya area lah, or inner thigh. Pressure ulcer usually bony prominence area macam sini, scapula, tailbone, malleolus. Or patient pakai infusion pump, dia punya tubing too long, it will create pressure injury on the faces juga kalau dia pakai lama. So dia punya shape untuk IAD dia tak ada shape, dia usually dia all over, tadi I kata rashes all over the buttock. Pressure ulcer is very distinct punya age kat satu tempat. Okay. Siapa nak try jawab ini? Yang mana satu IAD, yang mana satu PI? Ada siapa nak cuba tak? Yang cuba ada hadiah tau. Bila I datang Kuantan, I'll pass you the gift. Anybody would like to try or not? Don't malu lah. Unmute yourself. Introduce yourself. Ada siapa tak nak cuba? Tak nak then I will give you the answer. Anybody? Oh. Okay, if not, okay. I'll tell you, okay. Yang kiri IAD, yang kanan pressure injury. Can see or not? Yang IAD it's all over tau. Dia punya rashes all over dia punya buttock. So whereas pressure injury due to tekanan is just one spot yang merah sana. Ni sebelum dia on the right side, right, the pressure injury is just redness stage 1. Dia belum lagi develop wound, so you still can reverse. How do you reverse? I will tell you more. Okay, from B Brown we have skincare regime untuk prevent, protect and preserve the skin. You want to prevent and then after that you protect and you preserve the skin. So take the lead. Okay, untuk moisture, we have barrier cream and barrier film. But I think, sorry, boleh nampak barrier cream, it's already in the hospital, I know. I think, yeah, wait, can you see? Wait, okay. Yes, and this is barrier film spray. I think you do not use this, you use Cavilon in the hospital. Actually, it's just the same, silicone based juga. Untuk this, you use when patient on diaper. You want to create a barrier. You nak create barrier sebab you tak nak urine or feces terus kena di punya kulit. So untuk protect and improve skin integrity, we have Linovera. Linovera. Ada lagi pakai dalam hospital tak? Pernah nampak tak? Pernah nampak? Know the usage or not? So and then we have Linovera, we have Drasil border, we have Heal untuk prevention juga. Okay. So ini quoted from guideline daripada European Pressure Injury Advisory Panel because and also MPUAP they came up with this skincare punya guideline. Untuk implement skincare regime, you have to keep the skin clean, appropriate, hydrated, clean the skin every time after a patient every BO. Avoid using alkaline soap and cleanser. And they also mention protect the skin from moisture with a barrier product. This is mentioned by the guideline, not from B Brown. This guideline mentioned that you want to create a barrier on the patient's skin, that not dia directly contact. So also we quoted this from Wound International Best Practice Principle untuk IAD prevention. Nak pakai apa? But do take note, these few ingredients dia ada dia punya kesannya. Okay, for example, we have petroleum jelly. Petroleum jelly bila you pakai, dia akan form satu occlusive layer. Meaning to say, the layer, bila dia kena on your, you see dia mentions ini, may affect fluid uptake of the absorbent incontinence product. Sebab dia dah create satu occlusive layer on your patient punya diaper. So dia dah ada satu layer, bila patient dia kering or BO, dia dia punya pad tu tak dapat absorb sebab ada satu layer petroleum jelly kat sana. So this will create very moist environment to the patient punya skin, and then patient punya skin will tend to break because you know urine and feces ada banyak bacteria and germs. So here you want to use, you have to take note of this few punya kesan sampingan bila you pakai this. So this is for petroleum jelly. Zinc oxide, which is aqueous cream yang hospital masih pakai. I'm not sure about IIUM, pasal government hospital they are still using. Ini bila patient pakai, dia sangat difficult and bila dia pakai dia akan, how to say, they will kering on the skin, very hard to remove, and dia opaque, bukan ni transparent, so susah you want to absorb the you want to observe the skin, so you have to remove dulu baru you boleh observe. It's very hard to remove. Sometimes you remove too quick, you might create geseran on the patient punya skin. Imagine if patient punya skin sangat fragile, it will actually tear. You will eventually create a wound on patient. So it's not recommended to use zinc oxide because of the dia punya opacity, you tak dapat nampak, and then very difficult to remove. Here they have this ingredient dimeticon and acrylate polymer. These two are transparent. Okay, dimeticon is in barrier cream. They're usually non-occlusive and they're transparent. They're transparent. It's easy for you to observe patient punya skin. So you tak payah remove, you can already see patient punya skin. Bila you apply, you still can see patient punya kulit. And acrylate terpolymer is barrier cream. It's also in the Cavilon spray, dia punya ingredient. Dia juga tak payah remove, so it's transparent, so it's easy for you to inspect the skin. This another ingredient, I'm not sure because it's not available in Malaysia, so I will not touch on this another ingredient. Okay, moving forward. So barrier film spray, you can use patient on diaper, or actually some mereka juga guna on patient bila pakai stoma pad because you want to prevent the liquid kena di punya skin. For damaged skin, small cut boleh pakai because you want to prevent bacteria masuk. Like small cut, you terus pakai this, you will akan prevent the bacteria from going in. This line from outside spray, outside spray is made from alcohol. So bila you ada wound, you spray, you akan rasa sting. This is silicone, you won't feel sting at all. So I think you all sudah tahu macam mana pakai. You hold 10 to 15 centimeter away and then you spray. You will form a film. So you let it dry within 30 seconds. Okay, dia akan kering dalam 30 saat. So yang ini cream juga untuk prevent maceration, untuk protect the skin. So patient bila usually we suggest pakai cream sebab bila you apply, patient BOU akan wipe it off, then you apply again. But whereas firm spray ini, bila you dah apply, patient BO, you don't need to apply because it will be there for 2 to 3 days. Bila you apply nanti dia punya layer jadi semakin tebal, but sometimes you do not know, you mungkin sometimes might be another different nurse yang pakai, mereka tak tahu, or they already apply. Then what if another nurse lagi apply, nanti dia jadi semakin tebal layer tu. Because once you apply, it can last you 2 to 3 days on dia punya kulit. Whereas barrier cream, bila you remove, you clean the skin, you will be removed also. So it's easy. Bila you remove, then you apply balik lah. So you just apply one layer lah. Okay. Untuk Linovera, okay. Linovera. Composition dia ada hyperoxygenated fatty acid HEPA, tocopherol vitamin E, aloe vera, centella asatica, rosemary. Centella asatica apa tu ya? Ada tengok apa ni iklan apa? L'Oreal. Dia pun pakai centella asatica. Pegaga, betul. Yang makan ulam mesti tahu ya. Centella asatica is the scientific term for pegaga. Okay. Tak payah makan pegaga lah, apply Linovera nanti. So why kenapa pakai centella asatica dalam Linovera? Sebab dia punya mechanism, dia akan promote fibroblast and increase synthesis of collagen. Okay, our body does produce collagen, tapi as we age, dia semakin menurun. So perempuan paling suka dengar collagen this word. So dia akan tolong menambahkan synthesis of collagen. Juga dia pun improve the tensile strength of the newly formed skin. So dia kuatkan dia punya kulit, kuatkan tak nak bagi dia cepat pecah. So this is for prevention untuk Linovera. See, orang putih pun tahu kebaikan advantage of pegaga. So you tanamlah and jual kepada orang putih. Because tadi I mentioned, yes, as we age, memang kita punya collagen menurun. So especially old patient, dia punya collagen that lost and then weaken the skin. So the skin very less elastic. Bila dia less elastic, imagine kalau dia patient punya, okay, example dia punya butt dia sudah tak ada collagen, less elastic, dia punya skin dah weak. Imagine if pamper dah basah sangat, too much moisture, it will actually create a wound, very easily break. Sometimes kan, it's like nurses dah buat banyak, you dah buat positioning. Sometimes patient pun still develop because you have to have all this product to help you reduce your burden. It's not because staff tak buat positioning, but bila dah buat, patient still develop because tadi I mentioned mungkin dia punya skin dah tak begitu bagus. So you will feel very frustrated. You need all this product to actually help you reduce your burden and also improve patient punya skin lah. So indication for Linovera tadi I mentioned untuk prevention and treatment stage 1 pressure ulcer. Stage 1 is redness. Bila dia merah, you boleh ghostan balik lah. Tapi bila dah ada wound, you kena buat treatment lah. No choice. So kita punya dua ingredient yang tadi I mentioned, ada aloe vera dengan Sedela acetica, dia ada healing effect on the skin. Dia juga restore capillary circulation. Dia stimulate, tadi I mentioned, dia ada hydrating and healing effect. So Linovera ada hydrating dan healing effect. Untuk barrier cream dia tak ada. Untuk barrier cream dia tak ada healing and hydrating effect. Dia cuma protect the skin. Yes, okay, aloe vera selalu you pakai bila sunburn or you masak-masak kena minyak, you pakai. Betul dia untuk soothing and relieving effect. Especially kalau patient kulit dia kering kan. Imagine bila dia kering, dia tend to garu. Bila patient garu, eventually mungkin dia juga akan develop wound. Sebab bila dia garu, dia akan create wound juga. So depends on patient lah. Kalau dia garu kuat sangat, and then will develop. So bila pakai untuk soothing and relieving all this irritation effect, itchy effect. And also vitamin E untuk speed up the cell regeneration process. Okay, ini packing lama. I want to show you all sekarang Linovera ada new packaging. This is the new packaging. Boleh nampak tak? Ada sunflower, ada aloe vera, ada pegaga kat depan. That one is the old packaging. Yeah, I think you all are the first batch I show you our new packaging. Just masuk Malaysia with this new packaging. Dah. You look interesting kan? Tak macam dulu punya packaging. And also you see, I macam buat makeup tutorial pula. Cantik tak? Ada sunflower. Boleh nampak tak? Yeah, sunflower is the HOFA, hyperoxygenated fatty acid. Linoleic acid dia pakai. This is our new packaging. Yeah, I want to show you all. Sebab I think it looks quite nice lah compared to the previous one. Looks more attractive lah. Okay, I won't talk about the packaging. Okay, the maximum moisturizing effect adalah 8 jam. So you tak payah apply every time you buat positioning. Apply on all these bony prominence area or dry skin. So every shift buat every shift you apply. Tak payah apply every 2 to 3 times you buat positioning. Okay, why do we design it in oil form? Kenapa dalam oil? Sebab dia akan absorb sampai dermis. So that's why the moisturizing effect is locked inside the dermis. Whereas kalau you pakai lotion, it's just epidermis, cuma kat your epidermis layer saja. So the moisturizing effect is just there. Whereas kalau you pakai oil, dia akan absorb dalam. Even though it's oily, tapi dia cepat meresap. Myself pun pakai. I sendiri pun sendiri pakai. Okay, This is for prevention lah, pressure injury pakai on bony prominence area. But I had other client, dia pakai on outpatient DFU sebab dia punya kulit kering sangat macam sisik ikan dia kata. But then dia pakai 1 week memang jadi, the kulit is very well moisturized. You can actually try pakai on the patient kulit yang kulit kering sangat you can try pakai and also kalau some of you will ask, eczema boleh pakai tak? Okay, eczema as long as tak ada wound, dia tak ada berdarah, you buat patch test dulu on your hand. Kalau you sensitive, you tengok ada, lepas you pakai you ada develop merah ke tak. Kalau tak, then you can apply. So usually selalu we, but then so far I have not heard any patient yang sensitive dengan Linovera lah. So as long as no wound or berdarah, then you can pakai for eczema patient sebab dia ada kulit yang kering sangat. Ini perempuan tumit kering. Tumit kering 1 week memang jadi. I sendiri pun pakai. Because especially when you're sleep dalam aircon or sometimes you're working environment, you in ICU or OT in aircon, kulit you kering sangat, you pakai this for the moisturizing effect. So I want to show you sekarang kita ada buat case series dengan PPUM punya ICU. So dia punya title ialah Reducing Pressure Injury in ICU. So is skin barrier the solution? Okay, standard care. Standard care is mereka cuma buat positioning. Dia tak pakai apa-apa langsung, tak pakai zinc oxide, tak pakai apa-apa, tak pakai apa-apa solution or any cream or ointment on the skin. You can see, anybody can tell me what do you observe on day 3 and day 5? Sorry. Oh my God, okay. Boleh nampak tak? Jelas tak? The gambar. You can see, day 3 patient sudah, dia punya skin sudah tear, patient on diaper. So bila on day 5 dia dah start berdarah. Actually patient sudah develop IAD. Sorry ada picture dia punya warna lain nampak sebab some picture mereka take from different angle. It's the same patient, bukan different batok. Nanti you pun fikir kenapa warna dia lain. So some they record in the computer, they take from the computer so it looks a bit white. Okay. Itu ialah patient standard care buat turning tadi I mention lah. Lepas you dah buat turning susah payah, tapi patient still develop because you need all this product to help to reduce your burden. Okay, ada so itu untuk standard care. Kita buat standard care and we plus skincare bundle. Standard care is buat positioning. So skincare bundle patient pakai Linovera and barrier cream. Dua-dua pun pakai. So bila you pakai dua-dua, which one do you think you should apply first? Of course you apply dia punya Linovera dulu, oil dulu. Bagi oil absorb dalam, bagi dia increase synthesis collagen, improve the blood circulation. Then only you apply barrier cream kat atas. Okay? You can see day 1 patient punya kulit sangat kering kering, putih-putih, rasa nak macam dah nak apa ni? Very weak. And then you can see day 3 lepas apply Linovera. Patient punya skin hydration very good. 5, you can see no breakdown. Patient punya kulit bagus, cantik. Cantik tak? Kan? It's not that kita nak prevent juga, protect the skin, but we want to improve patient punya skin hydration. Ini juga same patient same arm 1, different patient, sorry. You can see day 1 dia ada putih-putih kat tengah dia. The putih-putih pigmentation is very, patient skin sangat dry. And you can see day 5 dia dah bagus. Prevent skin tear from moisture. Otherwise, dia punya patient, kalau dia tak pakai all this, patient also will tend to develop. You can see day 3 dia dah reduce, then day 5 cantik. Dah tak ada keputihan tu. Patient pakai Linovera and barrier cream. And here kita ada this patient, dia juga arm 1, that means dia buat standard care, lepas tu ada skincare bundle, ada Linovera dengan barrier cream. Here you can see day 1 dia punya kulit kering sangat macam sisik ikan tengok. Okay, you can see tak dia macam cracking sikit kat sana. So day 3 ada sikit crack lagi, tapi you can see dah start bagus dia punya hydration. And day 5, cantik. Macam I tengah buat makeup pakai you can see the patient punya butt cantik, right? Very good hydration and the punya texture. Kita nak improve the skin punya hydration and texture. You can see tadi dia punya texture from macam sisi ikan dah jadi cantik begitu. Bagus kan? So from protections we have, besides and all this, kita ada Askina Residue Border, we have foam heal. Ini untuk prevent sharing, geseran, friction, tekanan. Dia punya, we have the border silicone lah, sorry boleh nampak tak, adhesive. Ini untuk sacral lah, dia punya sacral shape. You apply on the tailbone. We have yang square pun, we have the rectangle. So this is to prevent, sebab sometimes patient kan, bila you dah buat positioning, you ada sometimes you need all this offloading juga lah on patient yang mungkin terlalu kurus sangat atau terlalu gemuk. Yeah, so you have to use this to prevent, untuk prevention lah. Tapi bila patient dah ada discharge, ada fluid, ini kena buang lah. Tapi selagi dia tak ada discharge of fluid, you boleh pakai. That means you pakai, then you observe the skin dulu, you buat cleaning, then you apply balik. Okay, up to 9 days selagi tak ada fluid discharge, you boleh pakai. And then untuk heal, kita pun ada heal juga. Dia dah design cantik-cantik for you, so you tak payah potong the foam, susah payah, because it might be time consuming. You just letak velcro tape di sana, then you apply. Boleh apply on elbow juga because the shape is the same. So especially patient mungkin dia duduk, especially kaki dia kan nak tahan, you will create ada geseran, then you will develop juga because you apply pressure. So you pakai heel untuk prevent pressure injury kat heel. Dia memang relieving form lah, help to prevent, good protection. And summary of pressure injury versus IAD. So pressure injury, tahulah, dah tahu kan, dia location dia ialah bony prominence, tempat yang tulang, especially because you apply pressure kat sana. IAD is peritoneal, tadi I kata, or even fall sometimes patient dia gemuk, sorry to say, dia obesity, dia ada full skin lab, sometimes dia ada moisture pun akan create juga. And also inner thigh patient especially. So for treatment pressure injury pakai Linovera pressure injury, and IAD barrier cream or barrier film spray. These two lain satu, the indication is different. So let's implement a structured skincare regime. Stop IAD, stop pressure injury. Dua ni lain. So imagine if you IAD, again I mentioned again because sometimes IAD is lain. If you classify IAD as pressure injury, you akan buat again I mentioned the pressure injury case will be high because wrongly classified. So you have to know how to classify any dua, and the prevention is lain. So let's start prevention. Ini untuk the whole kita punya skincare regime untuk prevention pressure injury. B Brown is your prevention partner. So any question on this? Ada soalan tak? Nampak chat banyak kejap. Banyak. Anybody has question? I see ada chat box, ada question tak? Oh, tadi ada y'all answer right, IAD left PI. Sorry I tak nampak because I present, I tak nampak. We have barrier cream, Linovera out of stock. Linovera out of stock, time to get Linovera matron. Matron ni ya, bergagal skincare. Anybody have question? Or I missed out? I don't miss out any question tak? I tengok chat box buat Q&A. Anybody have question? Tak ada, I carry on. I ada sikit lagi. Bear with me This is for patient. Okay, sekarang hot topic. Apa? COVID-19. Yes. Major topic for healthcare personnel skincare. Skincare untuk healthcare personnel untuk COVID patient because healthcare personnel pakai PPE lama sangat kan. I think sorry ada chat lagi siapa masuk. What is the suitable product for unstageable pressure injury? Unstageable pressure injury usually nanti I ada I will go to this later later matron. Okay. You see later I will show you also unstageable. Matron like already know what I want to share with you macam tu. Okay, so again the major topic yes. Okay, moving forward sekejap you can see ini healthcare personnel pakai goggle lama sangat and you develop pressure injury because you wear too long, especially pakai mask lama sangat on the ear sana. Yes, then you can see ini untuk patient lah, tadi untuk healthcare personnel, ini patient pun pakai on perfusion pump, ventilator lama sangat. This is the COVID patient intubated for 10 days, dia dah develop pressure injury unstitchable. But usually ini memang tak boleh prevent patient dah develop. Usually macam tu, we do not want to remove the yang keras tu because we do not know apa yang kat dalam. So usually what we do, we just do dressing, normal dressing, you apply. Tapi untuk surrounding dia, you still can apply Linovera. Here mungkin we do not want to remove, but you have to do normal. You maybe pakai hydrogel untuk soften biar dia tanggal sendiri. Or I'm not sure about at how selalu you buat dressing bila patient ada macam tu. Because usually they will suggest not to do anything on that thing yang hitam tu, bagi dia sendiri tanggal. Because eventually bila you buka, nanti you akan introduce bacteria masuk. Sekarang dia dah jadi satu layer, dia nak prevent bacteria masuk. But usually they will apply gel or what untuk soften biar dia sendiri tanggal. But continue apply Linovera on surrounding dia untuk prevent dia yang tengok, you see the surrounding macam kering kan, you apply so focus on protection. Ini untuk healthcare worker sebab healthcare worker sorry, this is for yes, healthcare worker PPE pakai lama because mungkin you pakai lama, dia punya local punya blood circulation lah too poor, and then ada ischemia, hypoxia, skin evaporation, and then some healthcare worker dia mungkin sensitif sangat, dia akan develop pressure injury juga. So especially all this forehead lah tadi, bila healthcare worker pakai all this, the malar area behind the ear, these are the most affected area. So untuk healthcare personnel juga boleh pakai Linovera because you want to hydrate the skin, especially behind the ear, the forehead, the nasal bridge. You pakai untuk hydrate your skin. You spray a little bit quantity and then you apply, then will do. Especially I know the healthcare worker pakai PPE kalau nak treat COVID patient, at least I think one shift 8 hours, lama juga because you will actually be painful. Sometimes you wear too long. Actually, you juga bila pakai lama, you akan, again I mentioned, you punya circulation sangat poor on that area, and you can use. Any question? Okay, I'm done for healthcare worker. So actually not just for patient, healthcare worker pun boleh pakai Linovera. Take care of your skin. Yeah, especially you all have to pakai PPE for too long, dealing with patient juga. Anybody has question? Ada soalan? Did I miss any question from you? Because I'm looking at the chat box. How do I see, macam mana I nak tengok Q&A punya box Sekejap. I only saw, I cuma nampak yang kat chat box saja. Q&A dekat mana Anybody has question or you feel shy? leave in the chat box lah. Okay, let me see. Ada tak? Ada soalan tak? Okay. Tak ada soalan lah. I assume this session has ended. Kalau you ada persoalan, you can let me know, or you can let Miss Suhaiza know, because she's the nursing educator that deal with me. You can let her know and I will answer you back. I pass back to staff nurse Vicky. Are you here?
Yeah, Miss. Okay, Fauzi Ibrahim. So not allowed to by host. So Bro Fauzi boleh tulis dekat chat box. So nanti saya akan bacakan dia punya soalan.
Oh, dia tak dapat unmute. Not allowed by host. I do. Oh, Sister Fauzi, is it?
Okay, Bro Fauzi, tulis dekat chat box. Nanti saya bacakan.
I will call. Yeah, Sister Fauzi ada I punya contact number. Yeah, I think sekarang IAUM pun treat patient, right?
Kalau Brother Fauzi ada kau nak kongsi apa-apa soalan, boleh kita sama-sama dapat ke?
Anybody got soalan? Yeah. Sister.
Hello, hi.
Hi, sister.
Hi, Ivan, how are you?
I'm
Long time no see.
Yeah, long time no see. How is everybody?
Okay, when I heard your presentation just now, you had mentioned mengenai even we already do the positioning to patient, but patient's skin still can back down, right?
Betul.
Okay, sorry to ask you, there is any research regarding that mengatakan kalau kita dah position patient, still boleh patient still boleh dapat sore. Ada apa-apa research ke?
Research tu I kena cari, but then this is actually based on what I heard from nurses punya feedback. Actually, mereka very frustrated. This is actually I heard review. I'm not sure ada tak, but if ada, I will send to you. I will cari.
Okay, one more thing. Okay, I pernah jumpa a few patient yang dia punya skin sangat tak okay. Even we touch the patient, we want to position the patient, dia punya skin akan breakdown. There is ada apa-apa suggestion from you, sebab skin patient ni terlalu fragile, mudah sangat nak pecah. So ada apa-apa suggestion from you? And one more thing, kita lama tak jumpa, so I nak tanya, there is any new sample or form yang can be used for patient for having a pressure sore? Sebab for now kita dah lama tak dapat tengok form sebab I tak tahu apa masalah. Then kalau you have any suggestion from your company or sample that can be used for patient with pressure sore, boleh you send me a sample?
Yeah, sure. Can, because usually I tadi mention pakai yang silicone adhesive. Sebab silicone adhesive dia tak kuat tau. Kalau macam macam micropore yang dia dekat sekali, bila you tarik, eventually nanti you tertarik patient punya skin. But this is very gentle.
Betul. Yang pasal you sebut yang pasal dia ada macam pelekat tu. Kalau skin patient tak cantik, bila kita buka, skin patient akan breakdown juga. Skin patient akan ikut dia pelekat. That sometimes yang kita ada isu tu. Kesian kat patient.
Betul, yes, betul juga. Is because sometimes you pakai dressing, you nak, how to say, you want to make sure dia kat satu place, you eventually you pakai micropore, nanti bila you remove, you akan create wound juga. But you can try silicone sebab dia sangat gentle, you can see dia akan tak tarik sangat. But I will give sister the sample. Untuk patient tadi you mention yang kulit dia sangat fragile. You can try pakai Linovera untuk kuatkan dia punya kulit.
Oh, Linovera Sasmi ambil dengan you lagi sebab I dah lama order, tak pernah dapat. I dah tahu apa masalah.
Store tak order sudah.
I hope Wuntin can do something regarding the Linovera. Linovera is very good sebab I already used the Linovera before.
Yeah,
Memang good untuk patient.
Actually,
Tapi saya tak tahu apa masalah sebab yang saya tanya dengan store dia kata user tak minta, jadi store tak order. Padahal memang kita minta. I don't know what the problem is. I think maybe Wuntin boleh find out what happened, what the problem is. Sebab Linovera memang kita pernah pakai. Memang bagus untuk patient. Saya tak tahu lah apa isunya.
thank you, sister. Yeah, I think so. If bila tak ada request, I think your store takkan beli, if I'm not mistaken. I
always do the request.
Thank you, sister. Yeah, thank you for the feedback. Actually, for prevention, memang I say you use all this moisturizing punya product. It's different, IAD patient on diaper pakai barrier cream or barrier film spray, but patient untuk pressure injury prevention pakai Linovera. Yeah, mungkin sister can try to. I don't know how to.
I will discuss with Metro One after this. Regarding this, but I still having many patients now, and we face a few issue regarding the pressure sore. I'm already aware regarding the sore all this. Tapi before this, memang kita use one of your product, memang quite good lah. Tapi sebab lama produk tu tak ada, bukan bila produk you tak ada, pressure sore tu timbul. It mean your product is good for the prevention, good untuk penjagaan kan. So maybe mungkin kita boleh bincang balik, nanti bincang balik lah dengan macam mana ni.
Ya, boleh. Thank you.
Sorry, Ivan.
Matron.
Using the Linovera because last year I'm not around.
Yeah, you were in.
So I'm not around. So when I come back, it's already ordered Caviar spray.
Yeah, hilang.
Okay. So since so many person my staff request for Linovera, maybe I will discuss with Idham, see how he can do about that.
Ya, macam kalau boleh tolonglah.
Because indication dia memang lain from spray. I pun talk to Mr. Iham, but then he said dia request beli untuk Linovera. Company Cavilon, they offer spray, and then they see the price cheaper they take, but actually they don't.
Because of all the KKM using Cavilon now.
Oh. Okay. But
so
line.
We see how after this, and we'll let you know.
Okay.
Actually, Linovera is good for prevention pressure injury.
Betul, matron. I think you already know this since when you know me.
Okay,
bukan
Iwan.
Bukan pasal ni bodek
No, bodek. No, sorry. Yes, sister.
Iwan, anything I will contact you later lah.
Yes.
Okay.
I will arrange this sample, the form sample for sister juga lah.
Okay, thank you very much, Iwan.
No problem. Maybe I send you a few Linovera for you to pakai dulu lah. Meanwhile, I think store trying to set. I don't know how IAD store work. Getting the Linovera. I think you have the patient juga kan. Sekarang
maybe Yvonne, for next time maybe you can arrange for case study for our patient here, so that we can promote to our management to get your product.
Yeah, boleh juga, matron. You see how things go. Sekarang how is condition in IIUM? I'm not sure, but I think you guys are treating COVID patient juga kan?
Yes, but maybe we can do as a virtual. We just take a picture and then send to you the progress. Because pandemic now, you cannot come here. You have to do swab.
I rindu Kuantan. I want to come lah. Yalah. Yeah, betul sekarang now they cannot allow sales rep masuk hospital juga because cases in Selangor quite high. I think orang Kuantan pun takut nak jumpa orang Selangor pun. Okay, I think that's all from my side. Nanti boleh share tak recording meeting ini? Yeah, sure. Sini. Okay, any questions?
Okay, ada soalan ke nak tanya Miss Yvonne?
Ada tak? I think tak ada kot. I think maybe we can end this. Wah, betul quite ngam our timing 2:30 to 3:30. I do have one. Is there any age restriction to use Linovera oil? Hi, I'm not sure. Are you staff nurse or Sister Umu? Okay. Age restriction usually tak ada, but then we because we don't have study on all this to support, but we mention not to use on neonate patient neonate baby kecil. Because we don't have paper support, but there's no age restriction, tak ada age restriction at all, because as you can see, the ingredient actually mostly are plant-based extract, and there's no animal, is quite safe to use juga. And don't worry, other animal extract, like sometimes they worry mungkin tak halal or what, but this is not. Our all B Brown punya wound care product are from plant-based extract, tak ada animal origin. And okay, do I answer your question? Oh, thank you, Miss. Welcome. Any question? Any question lagi? Ada tak? If not, maybe start. Thank you, matron. If not, then staff nurse Vicky, should we end this session?
Okay, so ngam lah 3:30 for 1 hour kita punya webinar. So great info. Thank you, Miss Yvonne.
Yeah, thank you.
We appreciate you being here. So siapa yang ada nak tanya soalan ke, mungkin boleh refer kepada kita orang punya wound team. So insyaAllah kita akan cuba yang terbaik lah untuk mendapatkan mana-mana produk from B Brown. So okay, see you next time. Thank you, Miss.
Thank you everyone. Stay safe. Bye-bye.
Bye.